Good morning, Arkansas, everyone. Dr. Morgan Sauer from CHI St. Vincent, the Longevity Center there, is joining us this morning to talk more about eating, overeating, and the effect on the heart. Dr. Sauer, great to see you as always, buddy.
Good to see you
Thanks
too,
for
man.
being here. You know, this is a time of year, the holidays coming up, and we're kind of in the midst of them right now, where a lot of people are going to look at eating more than they have all year long, probably. And even in some cases, you're going to have probably your biggest meal of the year in one sit down on one of these holidays. So let's talk about how that can affect the heart. I know some recent studies were done, and they measured a certain group of people. And what is that study, and what effect did they realize after eating a big meal on the heart?
There was a population of several thousand people, and it looked at what their incidence of having a heart attack was after consuming an extremely large meal. Now, the first thing is, what is an extremely large meal?
Yeah.
Typically, men need about 2,000 to 2,600 calories. Women need about 1,800 to 2,000.
A day.
These people a day.
A day.
These people consume 4,000 calories in one meal.
So double for men,
Yes.
and almost triple for women.
Yes.
I mean, that seems unfathomable. It seems like something like no one could really do that if you're average one. But then you look at, you know, what we do on Thanksgiving and on Christmas and on holiday seasons where we're able to eat so much. So they found that the heart attack rate, did it go up, or is it just the fact that did it trigger one?
The rate actually did go up because of the meals triggering this. There's several mechanisms that apply.
Okay.
First of all, high triglyceride load can actually cause less elasticity in the arteries. Additionally, a high carbohydrate load can unleash a huge burst of insulin, trying to cover up all those sugars that we bring in. When that happens, it allows for more inflammation of the artery linings. Also, when your gut is trying to process that much food it's not used to, it's going to pull blood from the rest of your body. So you can be in a blood-deprived state to other areas of your body for up to 6 hours after a meal.
6 hours?
6 hours. You put that inflammation, loss of elasticity, and lack of blood flow, and for some people, that's a heart attack waiting to happen.
Okay, so you mentioned the blood flow issues. Other parts of the body other than the stomach and the heart, anything else reacting to this overload of food as well?
Actually, the meals that we typically eat during the holiday season are going to be high in fats, which can certainly trigger gallbladder attacks in people who have gallbladder disease, both known and unknown. It's hard with gallbladders because gallbladder can also lead to some types of chest pain. So you're trying to figure out, is this a heart attack, or is it a gallbladder, or does someone just have really bad acid reflux from all this?
Yeah, and how do you go about knowing that? I mean, you mentioned people probably think, oh, I just have heartburn or something like that. How do you know the symptoms and the signs where you've got to say, okay, this is getting serious. I need to see a doctor at this point, because you do start to feel like some of the parts of your body aren't getting that blood or might be shutting down.
If you're middle-aged or older and you are having chest pain, an acute onset of chest pain, that's a good reason to go see a doctor. You're going to need to have lab work. You're going to need to have electronic tracing. You may even need to have some testing, like an ultrasound, to be sure that it's the gallbladder versus the heart. Remember, if you go and you don't have a problem, congratulations. If you don't go and you do have a problem, you could be dead.
Okay, so you mentioned a couple things. You mentioned the stomach, you mentioned the heart, which is very important for survival. I'm almost afraid to ask, and the gallbladder. Any other risks associated with such a high-calorie meal? We're talking double the intake of a daily value in one sitting. That's unbelievable.
And with a lot of those proteins, you're going to get a higher nitrogen load, which can actually cause you to have flares of gout or an increased level of uric acid.
Okay.
So gout sufferers may certainly have a problem with this, or you can see new gout attacks happen. If you have swelling, hot, red in one joint, usually it's going to be in the toe, but you can certainly get it in the fingers or hands as well. That's a gout attack. That will not be dangerous. It won't kill you, but it's sure going to hurt, and you're going to want to see a doctor.
Yeah, you don't want to have a miserable holiday season, that's for sure. Okay, now let's talk about tips to keep that 4,000 calorie count down. Not everyone does that, obviously, but there are some folks out there who tend to overindulge on the holidays when you typically don't. And how would you recommend? Yeah, I think a lot of us are a little guilty of that at times. How would you recommend, as a doctor, someone kind of take a look at what they're eating, maybe how much? What are the tips you usually give your patients that have issues with something like this?
Plan ahead.
Okay.
Just know what's going on and plan ahead. You can indulge a little bit. Everybody should. But be sure that you use like a salad plate instead of a dinner plate, so it appears that there's more food. Smaller portions. Don't go back for seconds. Additionally, about a half an hour before the meal, consume at least 10 ounces of water. Get something in your stomach to start making you feel full. If you can, try and avoid dessert, or if you do have some dessert, maybe a half a slice of pie instead of a full slice of pie. or those 3 pies.
Okay, so I got to ask you. You mentioned that before we end. Your pie of choice at Thanksgiving or the holidays, whatever it may be. What is it? What's yours?
Thanks to South on Main, it's changed over to pumpkin pie.
Really? Okay.
It did.
All right. Perfect. Well, we hope you have an enjoyable holiday season, Dr. Sauer. Thanks so much for coming in today. We appreciate it.
Happy holidays to you, too.
And once again, CHI St. Vincent, you can always contact them there at the Long.